Means for every homeopathic doctor, every patient is a research.
Yes, the homeopathy doesn't treat the disease, it treats you. It treats the person behind the disease.
Okay. I'm taking the allopathic medicine for thyroid, and my thyroid level, when I'm stopping it, it again goes back to the same
Exactly.
level. Yeah.
So homeopathy will either act or not act. It will never cross-react.
I see. Means you are an encyclopedia, right?
Not really, but I don't prefer patients going or hopping to different clinics or approaching different people when they can avail everything under one. So homeopathy is a 200 years old medicine. So it is a system of medicine which was discovered by a German physician. And when you take treatment, it's not about changing the outside or changing the stress. It's about altering your perception about the same stress which is happening. In homeopathy is quite different, I would say, because it is highly individualized.
Hello and welcome everybody. Before starting today's episode, I would like to thank Dubai. Because of them, we are able to do our shoot here, and the people who are standing by us to give us courage in this geopolitical situation, we are still safe. And second of all, I want to thank those mothers who have sent their kids, and because of them, we are safe. So let's start the today's episode. This is me, Sadhna, and this is my channel, The Attitude of Gratitude. We have a special guest today. Her name, I will introduce you within a second, but before than that, let me explain you what is she doing. She is a specialist for homeopathy, and I think a lot of people nowadays know what is homeopathy. So let's talk to Dr. Devinder Kapoor. Hi, doctor. This is Attitude of Gratitude, and we are welcoming you for the show. So can you please explain why you started your profession and who are you?
Thank you, Sadhna, for having me on this podcast. Indeed, it's a moment of gratitude for me that you have me on this podcast. So as you were asking me what is homeopathy, before I dive into the subject, let me give you a brief introduction of who I am. So as you mentioned, I'm Dr. Devinder Kapoor, and I am a homeopathic physician, so a specialist in homeopathic medicine. So that is my basic foundation and expertise. I generally specialize in the field of gut health and mental health. So these are two my subject matter expertise. And along with this, I also have other natural modalities which I offer to my patients. It's about energetic medicine or holistic medicine techniques like bioresonance scanning, biowell energy scans, looking into your energy chakras, and diving into functional medicine, scanning, blood works, and all of those. So everything under one roof.
Means you are an encyclopedia, right?
Not really, but I don't prefer patients going or hopping to different clinics or approaching different people when they can avail everything under one roof. So that's my motive and way to go ahead.
That's nice.
Yeah.
Doctor, can I ask you one question? Why you chose only homeopathy?
So homeopathy has been very dear to me ever since I found it. I would say ever since I found it, because I never planned to get into homeopathic medicine. It all happened, I would say, by chance. And that's how even now patients come to homeopathy by chance and not as a first choice. Yeah. So I had several years where my mom, she was struggling with recurrent episodes of fever, malaria. She also was diagnosed with meningitis, with recurrent episodes of fever, fatigue, body ache. And there were numerous lab tests run over her, numerous remedies given to her, painkillers, antipyretics, anti-inflammatories, but it did not settle. So that is the time when I came across one of my friends, and she advised me, or she suggested me rather, why don't you try homeopathy? You have done all that bit, now why don't you try this? And it's a natural system of medicine. And that took me to the discovery of homeopathy, because just with 2 doses of those minute remedies, they gave a very powerful outcome. The entire fever was eradicated, in the sense that malaria, as we all know, is a recurrent episode of fever. So even those recurrences got completely eradicated. So we actually delved into a root cause approach. We really eradicated it from its root. And that's how led me to understand more about this science, and I was fascinated by it. And that's how I took up homeopathy. And I really am amazed, even now in the process when I'm practicing homeopathy, I get to learn so many aspects of it day by day, and every patient gives me a powerful learning on that.
That's very nice. Maybe that was the plan of God, who wants to put you in this profession. So, doctor, let's start. Let's begin the topic today. And I would like to ask, first of all, I would like you to explain my viewers what is homeopathy.
So, homeopathy is a 200 years old medicine. So, it is a system of medicine which was discovered by a German physician. His name was Dr. Samuel Hahnemann. So he was a German physician, a scientist, and that was a time when, or an era in Europe where, the science was trying or becoming more and more mature. There were different laws coming into existence, like law of physics, law of chemistry, law of nature. So homeopathy is predominantly based on the law of nature, the principle of nature, and it works on the fundamental principle of law of similars, or we call it as like cures like. What does this mean? This means if a substance or a remedy is capable of producing certain signs and symptoms in a healthy person, that same substance, when it becomes a remedy, it can cure the same symptoms in a diseased individual.
That's nice. Yeah. It's a bit different than what I heard about homeopathy before, because maybe a lot of people are thinking that homeopathy is in a different way because nobody has explained us in a way, and maybe we have not ever asked the question.
Yes.
So can you please tell me how homeopathy is different than allopathic or naturopathy, or so many pathies are there? Yeah. So why homeopathy is different than that?
So homeopathy, I'll talk about homeopathy in the later part. Let me begin with other systems of medicine.
Right.
Though all these systems that you mentioned, allopathy or conventional medicine, naturopathy, Ayurveda, and homeopathy, they all aim at restoring the health.
Right.
Yeah. But their approaches are different. Their fundamentals are different. In a typical conventional or modern medicine approach, the target is towards the disease, to remove the obstruction, to kill it or fix it. So it's only targeting at the level of pathogens or the disease. It doesn't take into account anything else. So it may be very good in helping remove the symptoms that one gets, but it doesn't tackle what is underneath it. Yeah. So it's a kind of a suppression that we can get into with allopathic medicines. With systems like naturopathy, naturopathy looks at multinodal aspects. It looks disease as a biological process or a biochemical process, and it treats in that particular fashion. So it will take into consideration nutrition, lifestyle, herbs, supplements, and that's about the treatment scope.
I see.
Yeah. Systems like Ayurveda. Ayurveda is also an age-old traditional science, maybe more than 2,000 years ago. It was invented, and it speaks basically of completely different fundamentals, I would say. It treats the person on the concept of doshas, if you've heard of.
Right.
So doshas like Vata, Pitta, Kapha.
Agni.
Yes. So they are the basic groundwork on which Ayurveda thrives on. And it aims to restore the physiological as well as the metabolic aspects. So these are the metabolic imbalances happening when a person is diseased. Again, Ayurveda will use natural products, or I would say oils or herbs, or certain substances which are very biochemically active and pharmacologically active, and they are measurable doses. Yeah, they are ground substances. In homeopathy is quite different, I would say, because it is highly individualized. It takes into consideration the whole person, and it's individual to each. So what I mean by that is, no two people will get the same remedies who are suffering from asthma.
Okay.
So if you suffer from asthma and I suffer from asthma, both of us will get different remedies, because that is individual to you and the other illness is individual to me.
I think that is the reason when we go to the homeopathy doctor, they ask about, the person's mental or emotional or physical or maybe gut health. Their questions are basically different what an allopathic doctor will ask.
Yes, certainly. So homeopathy, when you go to a homeopath, so homeopathy rather is a science and an art both. The science is about understanding the body anatomy, physiology. The art comes in when the homeopath tries to elicit the characteristic expression of the disease. So homeopathy doesn't treat the disease, it treats you. It treats the person behind the disease.
Okay.
So that's why the homeopath will ask how you react to environment. What is the thing in food you like to eat? What are your likes? What are your dislikes? How do you perceive any kind of stress out in the environment? This is again a major area where we need to look at. When we go to modern medicine doctors or even research or statistics, they say that 70% or more of the illnesses, they come from or they are aggravated by stress factors. So you might have heard of doctors telling to their patients that, look, you don't have anything wrong. Stop worrying, do yoga, do meditation.
I am the example of this.
And that's it.
Yeah.
But that doesn't help. Yeah.
Right.
Because there is something else beneath it. So we need to understand now what is stress. Stress is again individualistic. Stress doesn't come from the outside. It comes from the inside, which means that how you are perceiving stress from your perspective. Yeah. And you need to change this outlook. So imagine a homeopath is going to inquire about this at this deeper level, that how are you perceiving the reality from your side? And when you take treatment, it's not about changing the outside or changing the stress. It's about altering your perception about the same stress which is happening.
I mean to say, means what I understood, let me explain you in a bit way. Means for every homeopathic doctor, every patient is a research.
Yes.
Means you are, as you said, that there is no same medicines we can give it to one kind of patient.
Exactly.
So means everywhere, whenever you are having same disease patient, it is always a research, like you are doing so many researches to understand the physical, internal and outside, ways of the person.
Exactly.
Yeah.
So the initial first case taking, a homeopath will spend around 1.5 to 2 hours easily with a patient on the first visit. Why? Because I need to explore this. I don't need to stay at the surface level just asking about symptoms. I need to go one level deeper. A simple example I can give you, that if I give you a common situation, like a young girl approaching to me, 3 young girls approaching to me, and the scenario is that they have disappointment in love or relationships.
Right.
Okay. These 3 girls are coming to me with symptoms of PCOS, for example, or some digestive issues or acidity, bloating. One girl will tell me that this disappointment has given me or resulted me into greatest shock. I'm completely numbed by it. I don't know what to do. The second girl will perceive the situation as, I was taking all the decisions with his support. He was the one to support me in my decisions. But now I don't know how to live my life.
Means totally dependent.
Yeah, she was totally dependent on him. So this is another way of looking at the same situation. The third girl will tell that I feel that he might be going around with another woman. So either it's her or me. So I will go behind her, I will kill her, and then I will kill my boyfriend. So that's a third perspective. So you see the same situation, but how these 3 people are looking at it from a different perspective. So this is important, and this decides what remedy I will give for each of them. So in the pharmacopoeia of homeopathy, we call it as materia medica. We have more than 4,000 remedies.
Wow.
So to pick that exact remedy with the exact symptoms is an art. I need to give that single remedy to the person, and the complete cure comes about in this case.
Very nice. It's very different. I heard about homeopathy. Tell me one thing, which all kind of disease homeopathy can handle? Is there anything which we cannot trust on homeopathy on one of the disease, or maybe some kind of disease?
There is nothing like that. So just coming back to what I said a few minutes later, before, is that homeopathy treats the person. It does not treat the disease. So homeopathy doesn't have medicines for diagnosis like arthritis, diabetes, hypertension. No, we don't have medications for standard protocols, but we have medications for person in arthritis who has pain in the joints, is unable to take that first step, and is better by heat or warm application. We have remedies for this. So this is a very, very unique expression of that person in that state. So that's how we treat the root cause. We don't go on the surface level.
That's nice.
Yeah.
Okay, tell me one more thing, doctor. This homeopathy, the patients who suppose have no problems, but they have some issue, internal issue, as you said, that you go inside the cause of the disease. Suppose I have no problems, but somewhere somehow emotionally I am not balanced. My body is perfectly okay. There is no pain, nothing, no disease, nothing at all. In this scenario, will you be able to help a person?
See, there is an important question, and the way to look at it is that your mind and body are connected. They are deeply interconnected. We are not treating symptoms, as I said, or part. So there are two ways where we can look at health and disease. One way is that you're looking at it as a part. So we all know that asthma comes from disease of lungs or a hyperactive immune system.
Right.
Colitis is a disease of the colon where there's inflammation. So if remedies are catered toward this part, we are removing those symptoms. Just like if some parts of the car are damaged or not in order, we try to fix those parts.
Right.
But this does not have a long-term solution. Yeah. For coming to a long-term solution, we need to look at something as a whole. So what I mean by whole is, we as human beings came into this world as one. We started to grow and develop as one. And we will end our lives also as one. This is the principle of holism. This is what we call it as holistic. So homeopathy goes one level deeper, going into the understand of holism. You cannot treat the part by giving a justification that this does not belong to the whole. That is why if you see many of the chronic illnesses like arthritis, diabetes, hypertension, or
Sugar,
any other,
maybe.
diabetes, I said, they don't have long-term solutions in modern medicines. People are asked to pop in pills for the rest of their lives. But this is not true. Because you're not involving the whole organism in it, you're just treating the parts. And this is a very important aspect of homeopathy.
Right.
You need to look at the whole.
So there are few kind of disease like thyroid, as you said, this diabetes, cholesterol. So if some patient is coming to you regarding for these issues, because see, I am a thyroid patient, and every day I have to take a tablet. So in homeopathy, is there any this kind of treatment which can help me to get rid of these medicines? Because of course, everybody knows that the allopathic has some reaction to your body once you take it, right? So in homeopathy, is there any treatment? And if the treatment is there, how long a person should take that treatment?
So this is again an important question which many of my patients ask, that how long we need to be on it.
Right.
So homeopathic remedies are acting, as I told you, at a deeper level. It is trying to restore your body to go back to its natural state. So the whole action of homeopathy is to stimulate your healing mechanism so that it can take care of itself. That is a very important action of homeopathic remedies. It's not doing a miracle. It is training your brain and your body to go back to its own intelligence to heal itself. So we are catering at that level, at a deeper physiological level, functional level, and they are the center controlling mechanisms of our body. For example, hormonal imbalances. We need to look at the neurohormonal axis, the pituitary hormonal axis. So anything to reverse on that stage, we need to go to that deeper level. And statistics and research have shown that these take their own time. It's not a quick fix. So we are trying to, what homeopathy is trying to do is trying to reverse at that level. And that level requires time. It's not that the medicine is slow. It means that their body is taking time to recover. Yeah, because we have, as human beings, we have tried to ignore those signs when they started to emerge.
Right.
So when your bodies were telling you, I have a headache, something is not right, I have bloating, I have acidity, we pop in a pill or we just ignore it. We just tell the brain to shut up. Yeah, that doesn't work. It goes deeper. So when it goes deeper and it is going at the level of repeated malfunctions, it goes to a stage where it is now at the extremes. Now to go back from here to here, it is going to take a while. Yeah. So that is the process, and it will work. And you have to work together on this. You have to work on yourself, allow your body, give your body that much time to heal itself.
So it depends on patient to patient.
It depends totally.
Okay, so I'll tell you one thing what I understood as if now about homeopathy. So the allopathic medicine or maybe any other medicine is just treating the disease.
Yes.
And it is stopping the disease then and there so that it will not go maybe this spread more. Maybe on the higher level. Suppose the thyroid levels go more higher. And the homeopathy helps them to remove from the root.
Yes, so it's a root cause approach.
Yeah, okay.
But as you rightly mentioned, modern medicine helps in emergencies, I would say. When your body is already undergone a lot of torture and it is the end stage now, to prevent into further damage, it's an excellent tool. You need to have a control on that. But again, it's only masking your symptoms. If you have a headache, or if you have hair fall because of thyroid, or you have dryness of skin, allopathic medicines you will take in and you will feel good about it. Your headache is gone.
Gone, yeah.
Yeah, your hair fall might show or might not show improvement. So that is a quick fix. You will feel good about it. But actually, it's not doing anything to the disease per se.
So that will stay because, of course, as I know, I'm taking the allopathic medicine for thyroid, and my thyroid level, when I'm stopping it, it again goes back to the same level. Yeah.
So it's just holding it there. And when you and this is called suppression.
Right.
So when you try to suppress your symptoms, there are two ways it can come out. It can go into deeper organs, it can affect multiple organs, or it can aggravate the same disease in a much higher way. Imagine a pressure cooker. If you don't allow the steam to go away,
It'll burst.
It is either going to burst or it's going to find its outlet somewhere else. It's a very well-known fact. Now, I don't know whether you have heard of it. Children, when they are little and they have eczema on their skin,
right,
and when you put a lot of steroids on the eczema, the skin will look clear, it will go away. But as the child grows in age, they will start to develop some symptoms of asthma or allergies. So disease is traveling more inwards towards the lung and the immune system. That is the ideal suppression which we say. Or it can just have its rebound effect at the level of mind also.
Right. So in a simple language, suppose if I'll explain to my viewers, it is if a drain pipe is there and water is coming every day to your kitchen. So you have two options. Either you see the cause from where this water is coming and you stop it then and there and try to treat it.
Yes.
If this will come in the drain, again you will stop, from the front so that it will not come. It will find out the other way to get the water out from that place.
Perfect. Yes. That's what the whole process is about.